So for new, whether it be mental health providers, psychologists, social workers, counselors that are trying to integrate within primary care or PCBH, what words of wisdom would you have for them if they're kind of totally new to it? What would you suggest to them? What would you tell them?
Well, I think this is the undiscovered country of mental health. So, what I encourage people to do is don't read a book and then say that's it. You can't go beyond that, but to keep experimenting.
Mm-hmm.
And to don't a priori think that we can't do magical things in these non-traditional environments. I think most of the time the thing that gets in the way is our own assumptions and our own self-imposed limitations. And certainly in my career that's been true. The main things I've had to overcome are my own self-imposed theories or assumptions about what could or couldn't happen, and starting out being more rigid that way, which I think is pretty typical when we come out of school. We tend to be a little more doctrinaire. We're kind of taught in a certain school, and it's hard to see things outside of that frame. But just being willing to have that frame be challenged, to see assumptions as assumptions, not truths, and to realize that assumptions can be magnificently instructive and useful, and they can be magnificently destructive and unuseful. I think having that flexibility to realize that you start from a place where you assume certain things, and then you operate from that point forward in sort of a iterative, logical, consequential way. If this is true, then this should be the result in terms of my behavior. This is what I should do. And then you have to check it out.
Okay. Now, if